So our next speaker, as I told you, is Dr. Anderson. We happened to graduate the same year from here with biology degrees. Back then, as Dr. Wheatley alluded to, it was just biology, thank goodness. I don't know if I would have gotten the molecular part. But anyway, Dr. Anderson is a ophthalmologist, and she has her own cataract and eye center clinic here in the Champaign, Urbana.
And I also work at the VA.
Okay.
That's my retirement. Okay. Where do I need to put this here? Is this all right? Can you hear?
Mm-hmm.
Can you hear in the top? All right. How am I supposed to? Are you going to do this?
So that's the pointer. I will.
Okay. Well, we can take a vote. I brought two things. Well, I brought three things. I brought toys, and I play with every day at work. I brought a lecture, which Dr. Berkowitz will get a kick out of, because you would just get a kick out of it. I took pictures on that file, okay? And I brought a video of cataract surgery, but I don't know if you'll get creeped out. My sister-in-law has infectious disease. She is creeped out by eyes. What do you want to see? What would you like?
Video.
The video. I knew it. That's why I didn't want to talk about. Okay, go ahead.
Oh, I didn't even. Is the video in?
We don't know where the video is. Well, I'm going to talk on this one. When you get bored of me talking, just say you're bored, because I am very different, as you can probably tell. I didn't give a rip if I got into med school. This is my hometown. So I grew up less than a mile from here. This university has been part of my family, my life. I come from 4 generations of engineers. There wasn't a chance that I was not going to be an engineer in here. So I started in what we called 42 years ago, it was called biomedical engineering, was called 5-year program, biology and electrical engineering. And guess who had to go to electrical engineering first? Me. You didn't get to start with biology. So there were 6 women in electrical engineering at that time. There are quite a few more now. And there were even less in ophthalmology, by the way, too. So I kind of had a good experience over the last 30-some years of training. But let's see, I'm going to bring you my courses. You want to learn about the courses? It helped me? Okay. I took 3 semesters of electrical engineering math, which is calculus, up to differential equations, I think. I took the usual chemistry, 2 semesters of organic biochemistry. I did a senior thesis in organic chemistry my 5th year because I switched out of electrical and decided to go pre-med when I realized that biology was easier than electrical engineering. So I thought you'd get a kick out of that. I did comparative anatomy, immunology, 3 semesters of physics, which I actually love physics. I love physics. I actually get excited doing physics. Doing light is the most fun to me, which is why I'm an ophthalmologist. And then I had to do some computer science and stuff. Go ahead to the next. I also didn't really care. I mean, when you're one of 6 women in electrical engineering, I got a job offer after my 1st semester. So I knew that I was going to have a job. I didn't really care what else happened to me. And so I went ahead and had a good time. And when I finally switched from electrical engineering into biology, I went to the dean of engineering and I said, I'm going to go try this med school stuff, but if I don't make it, I'm coming back and I'll finish. And he said, okay. So I knew I was set for some kind of a job. Women in engineering were few and far between 40 years ago. Okay? So I took literature, I took extra, writing so that I would learn how to write. I think that's very important that you learn different styles of writing, that you learn how to write scientific papers, and that you write all sorts of documents that you have to do forever, grants and everything else. I took a lot of economics. I almost was an economics and finance major because that was my easy A. Okay, and then just to goof off, we took art history, film, ancient history, and I took PE courses so that I could dance at my wedding and I could teach swimming and diving in the summers and get paid for it. Okay, so that's how I approach school. Go ahead to the next one. So my father at the age of 16 told me, I remember he was very, very smart, and he said at the age of 16, you were smart enough, and each and every one of you need to realize this. And it's too bad you didn't have my father sit you down and say, you are smart enough to do whatever it is that you want to in this world. And your job, this is what I tell my children, your job in life is to find out what you love to do. I am very, very lucky that I get to do the thing I love most, which is cut up eyes every day. They want to make you happy, but someone's got to do it. And every single day, I operate 4 days a week. And every single day, those patients come back to me and they, at the end of surgery, they go, thank you so much, I can see again. That is the greatest kind of job. My kids don't even thank me, and my dogs don't thank me for feeding them every day, so it's a great job. You have to identify your problems. That means when you talk to patients, you have to find out what they want from you. Okay, you have to find out what bothers them, okay, because everybody's got a different problem. And then he always said don't get too wordy. Write it in one page. And they also told us, because there was a lot of, the girls always had to be the secretary, so he told me never to tell anyone tonight, so I just have to be the secretary in the primarily man's field. And also, all of you women especially, you're going to have the smart kids, okay? I really believe in genetic basis. I don't know if it's true or not, but I believe it. All right, so what I did really quickly, college, mathematics, prisms, lenses, IOL calculation, everything we do in ophthalmology is expressed mathematically. Go on to the next one. I don't want to bore you too much. Chemistry. Today I just used all of this stuff. I gave drugs. I had to treat diffusion of sodium and potassium across the corneal membranes. I had to tell the patients you have to use the thick drops last because the other drops will not penetrate the more viscous liquid. And I have to use viscoelastics that are like corn syrup in order to keep my eyes from being chopped up when I operate. I use lasers probably 3 days a week. All right, all sorts of them. They dissolve. There's all types of lasers that we use. They dissolve tissue, they burn tissue, they freeze tissue, and explode tissue. That's a gag laser. So let's go next. The ions, when you get, and Dr. Berkowitz probably knows this better than I do, when you get your ions out of whack, you're going to die. Your patients will die. So if you don't know your acid-base chemistry, those little sodiums and potassiums and chloride and carbon dioxide, and what's the other, carbon monoxide, metabolic acidosis, they call it when you grow up and go to med school. But well, I'll tell you, you don't know that stuff, they're going to be dead. They're not going to breathe, and they're going to die. Is that true? That is true. See?
Thank goodness for instance.
Because those guys, fortunately, I'm only there for 10 minutes, and I don't have a problem with anesthesia. They get to do whatever they want when I'm operating. I'm like, did you want canceling? Whatever, go ahead. But you cannot mess that up. So you think it's stupid? It isn't. Because their eye drops sting, they're going to call you, and my eye drops are stinging, I don't want to take it. It's crazy. Go on to the next one. This guy got to lie. This is farming time. In the springtime, it's even worse. They put alkali, they put lye on the fields around here, and it blows in their eye, and it burns their eyes up. It causes liquefaction necrosis, which means it melts the eye. That's acid base. It's important. College chemistry and biochemistry. You remember the Krebs cycle? You guys, have you learned the Krebs cycle yet? You're going to see the Krebs cycle to your death, okay? You're going to be there. You're going to see the Krebs cycle forever. There's part of the Krebs cycle from the bio. And it's cool. It's really cool that these little cells make, energy and stuff. It's really cool. Go ahead. The labs, I actually did it differently also. I did a senior thesis with a really smart professor. He taught me how to do little tiny, do you know what the 25 millimeter Erlenmeyer flask, round bottom flask. They're little tiny ones, I think. They're the size of an eyeball. The little tiny ones, I think. Are they 25 or 5? I haven't seen one in 20 years. That little tiny one is the size of an eyeball. And he said, you have to learn how to deal with small things. It was very important. And he taught me how to write. And then I went to medical school, and I, of course, didn't volunteer there either. I only worked for money. And I did I did a project there and published a paper on low molecular weight polyacrylamide gel electrophoresis. You guys know electrophoresis? Do they still do that? Okay. Yeah, I invented that. And they wanted me to go talk, and I'm like, yeah, I'm kind of busy. I worked all the way through med school, too, so that's different. All right. Here we go, the cornea. Whoops, this isn't quite. Go ahead to the next one. All right, there's my cornea. This little layer called the endothelium. No, the inside
Oh,
one.
the
You scratch the outside, boy, that's the one that hurts.
Is it not working?
Okay, you see the endothelium? That's the sodium potassium pump. All right? So there's water that diffuses out to the epithelium, and the only way that it can clear and maintain clarity is to have those little endothelial cells pumping the water back in. Okay, so when I operate and I have bubbles beating up the endothelium, they stop working, the water diffuses into the cornea, the patients can't see, and they're not very happy. So you put, what do you think you put on there? You put a hyperosmotic 5% sodium chloride up there on the epithelium, on the drop, to draw the water out from the front of the eye, and then they can see again. So you have to learn those things. Let's go to the next one. Okay. All right. Then this is my sodium potassium, I think it's, oh, active transport and diffusion. That's the in and out pumps of the cornea epithelium. Go ahead to the next one. Embryology and ophthalmology is kind of cool. Go ahead and see what, I'll go back a minute. So the cool thing about eyes, when you take your biology class, this is what I remember since I like eyes, the location of the eyes determine if you're a predator or a prey. Don't you think that's cool? I think like the bunnies are have the eyes on the outside, the cows have their eyes on the outside, the cats, the people have their eyes in front. So like in the whole of life, we have different embryology and different adaptations. Okay, go to the next one. Here's the formation. This is what we learned in embryology class. Did you take that or no? Yeah? That old man, remember? He's so old. We had he was like 500 years old. He was like 500 years old. My God. I see him walk. He's so old. We got these fetal pig. Is that fetal pig class or was that biology?
Oh, that was biology.
So we had to like do these like how the animals grow and how the chicken grew like the frog and grew like the pig. And anyway, this is how the eyes make. Okay? Our eyes are formed, okay? And so you have the vesicles up here. See that little optic cup and stuff, and then go on to the next one. Oh, this is my ophthalmology in school. This is residency. Here we go. And immunology, we have to do that all the time. Here we go, allergic, go back. Allergic conjunctivitis, pink eyes, all these things. Immune complex diseases, rust rings, all those things that you see, you learn in immunology class. You just don't know it yet. You don't know that you're going to see it. Go on to the next one. All right, physics, again, I love physics. This is what a nerd I am. I would sit here and draw these ray diagrams for every single surface and combination of lenses, mirrors, and everything. On to the next one. This is contact lenses. I thought the diffusion, or the diffraction gratings were cool, and then we have the pinhole. In ophthalmology, when you grow up, you can put a pinhole over the people's eye and they can see perfectly. You're like, how does that work? Then you go on, what's this one here? Snell's law. Have you learned Snell's law yet? The change of the velocity of light as it goes through different indices of refraction. Do you think you don't ever have to learn that again? Oh, I'm sorry, here's a prism. You don't think you have to learn that again until you see somebody with their eye going out and you have to fix it. You have to put their eye back together, and the only way you can do it is cut it or put prisms in front of their eyes. You have to cut the muscles and realign them. These are just the different indices of refraction, crown glass and regular glass or plastic prisms, so you have to hold them differently because of their index of refraction and how they change the light, the rays of light. What's this? Internal reflection. Did you learn that yet? Okay. There's my gonio prism. I brought one for you. I brought one for you to see because you normally can't see where the white meets the colored part of the eye. That's where the drain of the eye is. And if you can't see it and it's sick and your pressure's high and the patient's going blind, you have to look at it, and you do it with the little gonio prism, which I brought. I'll show you. Excellent. These are the lasers that we use. I think lasers are cool. You can take bloody icky eyes, like this one's diabetes, okay? And there's not enough blood, so you have to kill the sick areas of the retina up in here. Now you can give them drugs. That was a new advancement in the last 7 years. You have macular degeneration where they bleed and they can't see, and so you have to stop that. It used to be treated with lasers. Now it's treated with macugen and drugs that they found in treating cancers of the intestinal tract. Go ahead. The other physics, pumps, I use pumps all day long. I have 2 pumps in my Baco machine. Go ahead. And then I just did art and go ahead. Art, so I could just like go to the museums and send my kids on art trips, and then, this is how you make money, okay? If you have a chance to make money, take these courses so that you can learn how to save your money, invest your money, and do it yourself. Read your own stock markets and read those little earnings before interest and tax